Okay, it's time to think about your healthcare plan for next year. I'm joined by Diana Falagowski, founder and CEO of Health Plans in Oregon, and Jeremiah Stroop, a health plan expert. Welcome.
Thank you.
For having us.
All right, Diane, let's start with you. Tell me about health plans in Oregon and what you do.
Yes, so Health Plans in Oregon has been around for about 17 years. So I started when I was 5. Let's be clear.
Child prodigy.
Yeah, exactly. So what we do is basically our mission is to be advocates and guides for folks to ensure that they have access to quality health care.
And we are in Medicare's annual enrollment period, so what should people know?
Well, Medicare is pretty complex,
Yes.
and it changes year after year. And what's great is it keeps improving. There's more benefits. But at the same time, to navigate those waters, it's really great to have expert advice from folks who really know what it takes to have quality health care.
Yeah.
Yes.
About 300,000 Oregonians could lose their Oregon health plan benefits, from what I understand. So talk us through what that means and what they can do.
So most folks nowadays are receiving letters from OHA or from the state of Oregon. Unfortunately, there's about up to 300,000 Oregonians that could lose their Oregon health plan. So it's very important that you're paying attention to your mail, and if you need help to navigate that and transition to an affordable health plan, we're here to help you, guide you through the process and make sure you get financial assistance if you qualify for it, and get you a plan that we'll make sure that covers your doctors, your prescriptions, and everything else.
Okay. I mean, how do you help folks navigate this confusing world? I mean, do you have a few tips you can share with us now?
Well, I think first and foremost, it's great to actually have people you can pick up the phone and talk to. They might even do a visit at your home or come to one of our offices and have those questions answered one-on-one. Because there's so much, advertisements out there and things online, but to have someone you can trust and connect with. What's so wonderful about Health Plans in Oregon is Diane has a huge team of these incredible independent agents that will kind of guide you step by step, which is so special.
Well, yeah, talk a little bit more about that role and just be more detailed. You say they guide you through, but I guess what is those steps you're guiding someone through, and like maybe some more of the common questions that they're asking you during this process?
So I think the biggest problem right now is most people are so used to paying nothing. If you're on Oregon Health Plan or Medicaid, you don't pay anything. You don't have any copays on everything. So everything is basically covered by the state. Now, when you lose your Oregon Health Plan, everything changes.
Yeah.
Now we have to figure out how much you can qualify for financial assistance through the Federal Health Insurance Marketplace, which we received grant from the state of Oregon in the last 10 years. So that's basically what we do, is help you navigate and see if you qualify for those financial assistance. And number 2, from OHP, we need to transition you to a private health insurance, whether that's Providence or Regence or whatever that might be. We're going to need to work with a plan that will cover your doctors, your prescriptions, or maybe medical services that you need to continue. So you guys, Oregonians can come see us at our offices. We also have a ton of events, community events that we do all across Portland Metro. We're available. We can even do home visits if you guys want us. And yes, you can ask for me if you want, or Jeremiah.
Yeah, you're here talking about it, but you're doing the work too.
Exactly.
Absolutely.
Exactly.
And Lacey, what's so really important for so many people when they're having this transition is, hey, can I keep my doctor? Because they have a relationship.
Yes.
What prescription drugs are you currently taking? What are the copays? And so to actually have a series of questions we can walk people through so we can actually evaluate where they're at and where they want to go. But beyond healthcare being like our bodies, it is also our financial health. Can you imagine being hospitalized, not able to work, and then having a huge medical bill? Over 66% of bankruptcies are directly caused because of medical expenses.
Yes.
Yeah. So you help the people with the financial aspect of it too.
It's protection, right?
Protection.
Not just
Yes.
for your body and your health, but also your finances.
And diversity is also really important to you. So I
Yes.
wanted to mention that for sure.
So being an immigrant, I came into the United States since 2001. It's very important to me that we're able to best serve those folks that came in this country from different countries, right? So it took me 10 years to build this team of Russian, Vietnamese, Filipinos, Hispanic, I mean, you name it. We have the major languages. So that way we could really best serve those folks that speak those languages, and more importantly, help them utilize their benefits, right?
Yeah.
Yeah.
Just because you're not a native English speaker doesn't mean you shouldn't have access to great health care. And so I
Yes.
love that. Diane has this heart. She goes out in the community. She works with a lot of nonprofits and shelters to make sure that even the disadvantaged folks have access to health care. So everyone should, I think, in the United States have access to great quality health care.
Well, thank you both for coming. How can people learn more and get more information and maybe talk to an agent?
Well, you guys can go to healthplansinoregon.com or give us a call at 503-928-6918. We're open every single day.
All right, thank you both for coming, and we'll see you next week as well. We're going to learn more over the next few weeks about this process.
Yes.
Be back.
All right.
Thank you.
And we'll be right back with more Hello Rose City. Don't go away.